The Tempe Fire Department says the city's average age for opioid abuse and overdoses is younger than national trends. Now, an Arizona State University research program is fighting the opioid epidemic by examining Tempe's wastewater. Cronkite News reporter Bayan Wang is live in the broadcast center now. Bayan, what are they finding in the wastewater?
Well, let's just say this. If you used a bathroom in Tempe, whatever you flushed down the toilet may have ended up in a testing tube at an ASU laboratory. Take a look.
The sewage doesn't lie.
If you used the toilet in Tempe within the last 6 months, there's a chance your waste was tested for drugs.
We've seen heroin, we've seen fentanyl, oxycodone, codeine, morphine.
And that's just a few of the drugs ASU researchers found while testing 3 geographic areas of Tempe.
We are analyzing wastewater, so we're looking for markers of behavior and health in wastewater. It's very similar to a medical process where the doctor analyzes urine or stool, but he does it for an individual. We feel we are the physicians of the city.
As the water travels from the 3 targeted areas in Tempe, it passes through underground pipes and eventually ends up in a larger channel where researchers set up their test. And while the research can pinpoint opioid traces in wastewater, it can also serve public safety and health officials in another way.
The city's website shows that in 2017, nearly 700 emergency calls were for suspected opioid abuse and overdoses.
Our trend is slightly different because we have a younger age population that's higher. Typically, the age 34 to 50 is higher on the national trend. Ours is 18 to 30. You know, to be honest, it could be because we have the university, but we see it all over the place.
Together, the city, the fire department, and researchers are working towards ending all overdose-related deaths by the year 2025, according to the city's website.
Imagine if we, through the analysis of wastewater, could tell the city officials that a dangerous drug has suddenly arrived in the city. There's a drug called carfentanil. It's an elephant tranquilizer. It's 1,000 times more potent than morphine. You know, if this drug is being spotted here, that's important information to have, and that can help us to prevent, by informing the emergency responders, to prevent deadly overdoses.
Within the next 6 months, researchers are working towards testing the entire city of Tempe. They told me all tests are sampled anonymously and that they hope other researchers replicate these studies throughout other parts of the nation. In Phoenix, Bayan Wang, Cronkite News.